Let's talk about health matters. The World Health Organization says climate crisis is the biggest threat to mankind, with more than 13 million deaths as a result of environmental causes. In Nigeria, air pollution, floods, fossil fuel exploration, among others, have had an adverse effect on access to good food and adequate sanitation and good hygiene. While the country battles with this, air and water-borne diseases have become a major source of concern. The question is, how do we create a sustainable and rich environment to reduce the number of health issues we're facing in the country and the world? Today is World Health Day, and the theme this year is Our Health, Our Planet. I've got joining me in the studio certified pharmacist and public health physician, Dr. Untitled. Thank you so much for being here this morning.
Thank you for having me.
It's good to see you.
It's good to meet you too.
Right. And via Zoom is the Secretary of the Nigerian Medical Association, Lagos State, Dr. Okon. Thank you so much for being here.
Good morning. Thank you for having me.
I'd like to start with you on Zoom. The 2022 campaign, just like I said earlier, to commemorate this World Health is our planet, our health. Speak to this theme as to what it wants to achieve.
Okay, thank you very much. So the World Health Day started in 1950 after WHO, that is the World Health Organization, was established in 1948. This day is meant to draw an awareness or make us come to terms with our health, which is the most important part. We say health is wealth. Without health, we cannot do much. So we have a day dedicated for us to pay attention to our health, and we have themes each year. So for this year, like you just said, it is our planet, our health. Now, for us as human beings, we have only one planet, and that is Earth. And in this Earth, we need to protect it and value it, because we have a lot of interface between the environment and our health. So if we do not protect our environment, our health is adversely affected. We talk about emission of fuels, emission of gas, fossil fuels are being burnt, we are falling trees instead of planting trees, ozone layer is depleted, so many illnesses, especially non-communicable diseases, have one thing or the other to do with environmental effects, especially tobacco and other things like that. So we need to draw particular attention and make sure we protect our environment. Like you mentioned, 13 million people are affected every year because of environmental related illnesses. So we need to pay particular attention to it. It's as individuals, as communities, as a government, policy makers, we have a whole lot to do.
Right.
So I'm very happy we are drawing attention to this. Thank you.
All right, makes sense. Let me bring you to the studio, Dr. Ekanem. Are we, based on what she said and what this theme actually seeks to achieve, are we able to reimagine a world where clean air, water, and food are available to all?
Yeah, so like the good doctor said, if we're looking at the health and the environment, we're looking at what we call the One Health approach, where we create that balance between humans, animals, plants, and the environment itself. Because, like she mentioned, there is an interaction, a constant interaction between the environment and humans. And the way we protect the environment has a way to have, has a lot to do with the way we survive and how we are able to, carry on our normal activity in the environment. So, air pollution has actually been a serious issue, particularly for industrialized areas in the world. And there has been some efforts in the past and currently by the World Health Organization to see how we can reduce some of those triggers or the drivers of air pollution. Unfortunately, in some areas in Nigeria, to be specific, we still see gas flaring occurring. Just recently, we noticed that it was just recently that the governor of River State, Dr. Mwike, was able to lead a campaign, to reduce the proliferation of illegal modular refineries that was emitting so much of these gases into the atmosphere. I think we need more concerted efforts like this to identify some of those triggers of air pollution and address them headlong by meeting the right stakeholders and getting them to be committed towards creating a better air environment for all of us. Other issues, environmental issues like flooding, all right? Flooding has been one of the main causes of or drivers of water-borne diseases like cholera, hepatitis A and E, and even typhoid. And that's why you notice that in Nigeria, most times during the rainy seasons where flooding is occurring almost everywhere, we have cases of cholera, which undermines the health of the average Nigerian. So I think it's time for us to picture that health-friendly environment. And for us to be able to achieve that, we must identify the triggers, those drivers, one of those factors that undermine the health status of our environment and address them headlong. We must ensure that we address all the issues that are involved, whether it's about drainage system that causes flooding or it's about gas flaring that causes pollution. We must make sure that we address them effectively.
All right, let me go back to Zoom. Dr. Okon, you also spoke about the climate effect on the climate crisis and how it also affects the human lives. Go to Somalia, for instance. They are faced with drought and loss of livestock and flora. That a lot of people, more than 6,000 people, have actually left their home, with an increasing war situation in Ukraine, which has actually changed or redirected the humanitarian aid to Ukraine. And those people, whenever they see vehicles, they always want to run to it thinking probably it's coming from humanitarian aid. So speak to this: the drought they're experiencing and the climate crisis. Is it exclusive to those desert areas, or is it something that can also affect us, looking at the fact that there is heat in the land at the moment?
Yeah, so humanitarian crisis in Somalia, there are war-torn areas. Let us not forget that we have some instability in our country too because of the security challenges that we are having recently. So people are having to move because of security challenges in the areas where they are. Emission of heat is everywhere because the ozone layer is getting depleted more and more, and this has related to the emission of gases too, and our not being able to go green. When I say go green, we're supposed to plant more than felling of trees. We want industrialized places. We want to build more. So because of that, we are moving right into the places where the trees are supposed to be protecting the environment and all that. The gas emissions, people are saying, okay, even as individuals, we can even impact positively in our environment by reducing the emissions from our vehicles. They said, okay, maybe once in a week, try and go to work with a bicycle or walk or pull cars, so that we don't have so many cars on the road that are emitting these gases that are depleting the ozone layer. So it's not only in Somalia, we have it in Nigeria, we have it in Lagos, especially these industrialized cities like ours. So it's here. It's right here.
I'm not sure how that is going to be. Let me use the word acclimatize in our own climate here, because when we say we go to a workplace, a place of work with motorcycles, bicycles, for instance. We've seen British Prime Minister Boris Johnson, or walk or take a walk. We've seen British Prime Minister Boris Johnson. We've seen Emmanuel Macron, and so on and so forth. All those world leaders who have money. You can't imagine our president, for instance, going to the Aso Rock with bikes. So how do we domesticate this kind of advice in our own reality?
Well, We just have to try, because let us see, like, how about pooling cars, like I said. So we have some people that are going to the same place. Instead of us taking 5 vehicles, can we take 1 or 2, since we cannot walk or take a bicycle? So we have to try as much as possible to look at what applies to our environment and see how we can apply it. I know, yes, it's difficult, especially like in Lagos here where we are. It could be very difficult and challenging. But, we just have to try, because, like I said, we only have one planet, and this is our Earth.
Right.
So we have to look at it holistically.
Absolutely. Dr. Ekanem, well, if anything, because I could remember very clearly that, during the pandemic, you were always here giving advice and all that, talking to us about how to live our lives. And here we are today, not on the other side, really, but, we've really understood how we should be living our lives, at least. So if anything, the pandemic dealt seriously on our global health and economic, well-being. What lessons has the pandemic really taught us today?
Well, thank you for that question. And I want to say that I see the pandemic as, for us, as Nigerians and Africans, as a blessing. Though we had some lessons to learn. But what I said it was a blessing to us, that it reawakened our consciousness as far as our health is concerned. Infectious disease control has been something that we really never paid serious attention to until the advent of the series of pandemic, from the Ebola to the Lassa fever to to COVID-19, which was a mega one. And now you're now seeing Nigerians being more health conscious. Apart from that, you are also seeing a lot of commitment, from the public sector, from the government, from the private sector, from the social sector, the development partners. Yeah. So in all, I think the lessons we've learned is, to pay more attention. Like the good doctor said, our health is the only asset, the only true asset we have. Yeah. Because the day we lose our health, that's the end of everything. So the lessons we've learned is to be more conscious about our health. We should pay more, more attention to what we eat, to where we live in, to the kind of habits that we indulge in, so that way we can lead healthier lives. And of course, it's also a lesson to our policymakers, all right, that we need to prioritize health. Before the advent of the pandemic, I can remember that we had just about 3 reference laboratories in this country, one in Ira, one in Abuja, one in Lagos. But right now we have over 100 of those reference hospitals. And our question will be, how do we maintain them? How do we sustain them? I think one of the lessons that the policymakers have learned is that for us to be able to lead healthier lives as Nigerians, we need an effective and a resilient healthcare system that can support the delivery of healthcare services to people who need them. But one more thing I think we should learn, and perhaps I expect to see that in the coming years, is the role of funding. We need to understand that we need that healthcare system requires funding, because I've carefully looked at the fact that even with the advent of the pandemic, I've not really seen that substantial, difference in our annual budget for health as it would have been expected. But of course, I know that there's no country in the world where the government alone supports healthcare system. We need to bring commitment from the private sector and from, of course, the social sector. So I want to see more of that commitment from all of these sectors to invest more in our healthcare system, so that we would be able to sustain the health system and prepare for even more pandemics, if at all they would come, so that we can have a better healthcare system for all of us in Nigeria, in Africa, and the rest of the world.
All right, Dr. Okon on Zoom. I also wanted to speak to this issue of the pandemic, vis-a-vis what WHO highlighted, saying our disease burden, which include unsafe water, sanitation, hygiene, and poor ambience and indoor air quality as the main contributors to our joint burden, the joint burden rather. What would you say to this?
Sorry, before I go to that, I forgot to mention earlier that part of the lessons we learned from the COVID-19 pandemic is that we do more things virtual than physical now. And that can be one of the things that will contribute to reducing the emissions. So instead of driving to the offices and all that, you can work from home more and do more things virtually instead of physical.
Yeah, and I think that's what we call the working from home, and not even working from home only. It has been supplanted by working from anywhere. Is that not what it is?
Yeah, even telemedicine now, we do that more. Because I remember during the lockdown that people were having difficulties getting to their doctors. We invented that. So we had, like in Lagos State, we had the Eco Telemed, where you could reach your doctor online. And except it's absolutely necessary and it's an emergency, you don't really have to go physically to the hospital. So I just said to mention that as the effects. Yeah. So, sorry, can you quickly take the... what did you say about WHO?
Yeah, WHO highlighted our disease burden, which include unsafe water, sanitation, hygiene and poor ambience and indoor air quality as the main contributors to the joint burden. So how do we begin to look at this and ensure that we have a safe place, we live in a safe climate, at the end of the day, having quality health?
Okay, so we know that, my senior colleague, actually in the studio mentioned, flooding. It's part of the things in the environment that is directly related to water-borne diseases. So the government has a role to play in that. But for us at home, there are simple things that we could do to make our homes safer. It starts from what we consume. So we try to reduce artificials, package and processed food. So and turn off lights, because emissions even in the home. So we turn off lights so that we can save energy, use energy saving bulbs and all that. Our source of water, we watch out for that and make sure we have clean and safe. It's interesting that these days we operate like, I was telling someone, I'm like a mini local government on my own. I power my house if there's no electricity coming from PHCN. I have my own borehole sank, and I just make sure that everything is going on well, just to make sure that we're comfortable and we live healthy. So we have some little things that we do as individuals in our homes that can protect our health.
All right. So
I hope that speaks with you.
Makes sense. Let me bring you to the studio for a final thought. Dr. Ikanem, you see, she spoke to the fact that we need to ensure that our environment is okay, the kind of emissions, carbon emission. But in this day and age, the current reality, we know how often we don't get power supply. People have to run on gen. So the noise pollution, the carbon emission, etc. What can be done to break these cycles of destruction for the planet and, at the end of the day, human health?
I think there's a need for us to actually, follow the principle of One Health, like I mentioned much earlier. You see, there's nothing that is not doable. It has to do with commitment from all the relevant stakeholders that are involved. I think it's necessary that we look into power generation. It's absolutely necessary.
We or the government?
Well, the government, right, as it is, because it's power generation happens to be on the exclusive list, and of course it's the duty of the federal government to provide that. Which is, I think, is one of the things that we need to change now. We should probably move it to the concurrent list so that state governments can produce. The fact that maybe Kainji Dam or Shiroro Dam does not have power supply should not shut out the entire country. We should be able to decentralize power generation to different states so that states can demonstrate that commitment and ensure that power is available. Because if the state can provide adequate power, then the proliferation of generators of different carbon emission rates would be seriously addressed. Again, like she talked about issue of emission from cars and all of that. In some of the Western world, you know, there is a lawn. In all the roads, you see bicycle lawns where people can actually bike, right? It's almost impossible for you to introduce bicycle riding in Lagos, when even Danfo would be struggling, even the pedestrian roads. But so one of the things we should do is, in the planning of our roads, we can include those lawns for people who are biking, so that they can actually use their bicycle rather than, you know, taking vehicles. So I think it needs a total approach, a holistic approach. All the stakeholders involved must come together and demonstrate commitment towards addressing all the factors that are responsible for this emission.
All right, thank you very kindly. We really appreciate your insight into this topic, this very crucial topic, you know, marking the World Health Day, our health, our planet, all together. Thank you. Via Zoom, certified pharmacist and public health physician, now here in studio, Dr. Insebase Kanem. Thank you very kindly. And via Zoom has been the Secretary of the Nigerian Medical Association, Lagos State, Dr. Ime Okon. Thank you so much for your insights too.
Thank you. Have a nice day.
Thank you for having me.